Dr. Michael Ryan with Missouri Vein Care discussing men and a vein condition. So men can get a vein condition, as can women. Women are more common. The ratio is about maybe 3 to 1, so 3/4 to 80% of patients that I see in the office are women. 20% or a quarter are men. So men can have a vein condition, just not as common. I know from my own personal experience, having suffered from a vein condition since I was in medical school, it does affect men, and it is truly miserable when it's untreated. There is a perception, and there is some truth to it, that men don't really get vein problems, especially if you look at the legs and they look normal, which is the case for most of patients with a vein condition. Their legs really look normal for men and women. So men will not consider, maybe this is a vein condition. Men don't really like going to the doctor. For men that aren't considering what might be an obvious and simple solution, they trudge through life, they're achy, they're tired, they're fatigued, and they end up, just like other patients, women who have a vein condition, they get a tremendous amount of fatigue. They often will gain weight. And I can remember one patient that he was the champion post-treatment weight loss, because weight gain is a common pattern that we see, and it's due to the fact that people are so fatigued they sit around for 5 or 6 hours every evening because they don't have any energy to do anything, and they are not burning as many calories. But this gentleman had could not believe after treatments how much more energy he had. He did his 10-hour shift or 9-hour shift and came home and would sit and do nothing, and he'd been doing that for a couple of years. But within 6 months he had lost 80 pounds. And I said, how did you do it? He said, I just got active and I could do it for the first time in years. So he was very excited about that. The one thing that you don't want to have is a situation where you're declining more and more every 6 months, to the point where you're now not really able to fulfill the role that you fulfilled for the previous 10, 20, 30 years of your life. So you want to preserve your activity, to preserve your stamina, and to preserve your function in that important role in your family. Having adequate circulation is important. That's one thing to consider, and that is something that people that have a vein treatment experience, which is, yes, I've got more energy. I'm back to normal. People want to be back to normal. So Dr. Mike Ryan discussing some of the issues of men and vein disease.